We can make the best and most suitable treatment plan for the patient in front of us. But if they cannot commit to it and it won't get done, then everyone's hard work is for nothing. Today, we'll be going through simple, practical tips that you can use with any patient in front of you to help them commit to the plan you make it more likely to get done, and help them think that it's really going to help. Welcome back to Clinical Communication. My name is Ben. I'm a specialist physio and clinical communication skills facilitator here in the UK. Today, we're discussing about commitment and how we can help patients commit to the plans that we make together with them. This is the other end of behaviour change. The other end of coming up with questions that help them come up with the idea, making a plan together. This is the end part, how we can make that plan more likely to stick and more likely to happen. The things we'll be going through today are very simple, very practical. You can use with any patient you see. And do let me know how you get on using these strategies today, and any ones you use as well that I don't mention. I'm at BYBrowPhysio on any social media you're on, so let's dive in. Probably the simplest and easiest option here, before you go into any specifics with certain technologies or writing things down, is actually simply to ask the patient in front of you, what could you commit to? What could you do? Now, this will save a lot of time of having to negotiate strategies or times of day or ways they could implement it. If they come up with it and they say it themselves about what they commit to or could do, it's more likely to get done because they've said it. Okay, it's not a guarantee things can happen or come up in the way, but if they've said that they could do 2 to 3 times a week of something, or every day, or whatever it is, then it's more likely to get done because they've come up with it, and so already they're thinking it's more doable. So let's say they come up with 2 or 3 times a week or every day, or whatever it is for the thing you're suggesting, whether it's, again, exercise, certain foods, certain mindfulness, psychological things, taking medications, whatever it is, whatever the change is. Get them to write it down. Now, it is normal for us as clinicians to want to write it down on paper or print out something which all got written down, but it's more powerful if they write it down, whether it's on paper or, better yet, on their phone, right? They'll have their phone on them. I said to you last week, 99% of patients have their phone on them when they come to you. So get them to write it down. Okay, they're again taking more ownership of it. The more they own it, the more likely it's going to get done, more likely they think it's going to help. Or if it's something you can record, most of their phones have a camera on them. Okay, so is it something they can photo or they can record? Okay, whether it's, again, a demonstration of the exercises of either you or they doing it, if it's a certain meditation or certain psychological tool, perhaps a link that they can put on their phone, or something they can film of certain positions to do it in. If it's a diet, or certain photos they can take of certain foods, whatever it is, okay? Can you record any instructions, perhaps in a voice note, again on video, just so they've got it? People find it a lot harder to lose their phones than they do a piece of paper, okay? And again, if it's on their device and they've recorded it, it's more likely to feel like they own it. Okay, so whether it's writing it down on the phone, writing it on paper, recording it on the phone, however it is, but get them to do it. Don't just write out yourself or print off some generic sheet. So once they've recorded it on their piece of paper or in their phone, is there a way that they can record themselves doing the change while they're away from you in those weeks, months, however long it is? Are there some boxes they can tick, something they can put scores in, perhaps take photos of them doing the change, whatever it is, to show that they are making the changes to you and to others as well, because they're not just going to be committing to you, we ideally want them to commit to other people in their life as well. So Robert Cialdini wrote Influence, which is the Bible for behavior change, way back in the 80s, and he had 6 principles for influencing behavior change and people in general. One of them was around commitment and consistency. Whether it's with healthcare related stuff or just anything in life, one of his big rules is, if someone has said that they're going to make a change or do something, they are then more likely to do it as a result. And the more people we tell, the more likely we are then going to do it. Okay? Because we don't want to lose face. We don't want to let people down. So, with that person in front of you, can you ask them, who can you share this plan with? They've written it down on paper, they've recorded it on their phone, they've got ways that they can record their progress. Who can they share it with? Whether it's someone at home, whether it's their friends, people at work. What we really want, the ideal, is them to put it on their social media to show tens, hundreds, potentially thousands of people about the changes they're going to make. And this is because the more people that they tell and they say that they're going to make the change, the more likely they're going to do it as a result. So once they've then shared this plan with whoever it is at home, friends, work, wherever it is, can those people then help facilitate the change as well? We are generally more likely to make a change and go along with it if we feel supported, not just by the clinician and the person at the service we've been to see. They're not going to see us for weeks or months. But if we've got someone in our life, whether it's, again, someone at home or very local or at work, social life, wherever it is, who can support us with the change, act like a little cheerleader almost, but not too annoying, then it's more likely to help that change happen. For example, if it's around certain activities, it doesn't have to be exercise per se, maybe going out socializing or doing certain things in a group. Are there people in that person's life at home or in their social network who could go with them? Or if it's a diet thing, could the person or people they live with do the diet with them as well? If it's a certain task, like whether it's mindfulness or relaxation, could the people in life do it with them? Okay. The more support we have, feel that we're as part of a team, the more likely we're then going to make that change. And finally, for today, when they've written the plan down or recorded it on their phone, they've got ways to mark their progress. They've told people in their lives about the change they're going to make. Is there anything in their environment that may need to be changed to make it more likely to happen or to help facilitate the change? The environment wasn't something I ever used to consider. You just make your plan, make sure they're happy with it, make sure they write it down and have ways to progress, and then hopefully they'll just do it. I remember seeing, let's call her Joan, a few years ago. Joan had a plan, had a way she could manage her condition in theory, but the house she was living in was from a previous abusive relationship. And it was traumatic to be there every day. And it made it hard for her to move forwards. We've made all the right plans, all the right suggestions, but nothing was going anywhere. And it wasn't until we helped her work with the local authorities to move house to a different location, then her quality of life improved. And she was able to then use the strategies because she wasn't focusing or being reminded of her past experience where she was. So if appropriate, can you change that environment to help facilitate the change? It's often not going to need a big, house move, but it may just be, can the certain piece of equipment be put in certain places to make it more likely to be done? Or can the healthier foods, if it's diet thing, be put in an easier to grab location and the unhealthy ones put further away? We're more likely to make a change and to stick to the change if it's easy to do. Okay, and if we need to do that in our environment to facilitate that, then great. You may need to ask the patient some questions to clarify about how best to set things up, but it's not something people often talk about, but it can make a big difference to the plan you're going to create. And also, if it can stick in their mind, then they're more likely to think whatever that plan is, that's going to help. Hopefully you found these ideas useful. Go and try them with the people you see next week. They will work for most people you see, regardless of whatever speciality you are in. If you'd like this, as always, do share it with anyone you feel would benefit from it. I am at BYBrow Physio on any social media you are on. Please do share it with others. Do send me any questions you have, any guests to suggest, and anything else you want to ask. Thank you for watching or listening, and I will speak to you next time.